Hello, everyone. We are so happy you are joining us today for another webinar with the Canadian Association of Social Workers. As always, I'm Alexandra Zanis. I'm the Social Policy and Communications Coordinator here at the CASW. So welcome. Thank you for joining us from wherever you are, wherever you're at. We're so happy if we're in your homes, your offices, or any kind of space you're in that you've let us join you for about an hour today. We are joined by two absolutely incredible webinar presenters. Our moderator today is Dr. Deepen of the Ontario Association of Social Workers, and we are also joined by Senator Wanda Barnard. So the CSW is, of course, so grateful to have this partnership, and we're so excited to have what feels like a very timely conversation on race, health, and COVID-19. So I am just here to do a couple little quick housekeeping notes, but please know, everyone, that I am on the back end. If you have your normal questions about certificates of attendance or anything the CSW operates on, you're more than welcome to use your Q&A box. For all of you out there who are maybe new to our platform, welcome. We're so happy to have you. Just take a minute and make sure that your screen is totally customizable for your personal viewing needs. So you can make us bigger, you can make the slides bigger, you can add some of the widgets on the bottom up to your screen, whatever you need so that it's the best learning experience for you. I would recommend typing your questions throughout the presentation as they come to you so that we can compile them for a more formal Q&A at the end of the presentation. So please feel free to use that Q&A box anytime you would like. And don't worry about typing too many questions or too many comments. We love to hear your feedback and engage with you that way. One other quick little housekeeping note is the certificate of attendance. For all of you out there, you need to view about 40 minutes of this presentation before that is accessible. And you can log on to this platform anytime and access that certificate of attendance. You don't need to have it today. You can come back on whenever you need and download that with your name and the date and everything. So with all that being said, like I mentioned, I am here if you need anything, even if I'm not on screen. So please just let us know, and I cannot wait to pass it over. I'm going to pass it over to Dr. Deepen from the Ontario Association of Social Workers. Thank you so much for joining us today. Take it away.
Thank you. It's so exciting to be here. I am excited to join you, Alex, and Honorable Wanda Barnard. It's my pleasure to get to listen in and moderate and participate on today's important topic. It's with my privilege and pleasure I get to introduce the Honorable Wanda Barnard. Senator Wanda Barnard is the first African Nova Scotian woman to be appointed to the Senate of Canada, and she's a senator in Nova Scotia, East Preston. Representing the province of Nova Scotia and her hometown, East Preston, Senator Barnard champions issues impacting African Canadians and people living with disabilities. She's particularly invested in human rights, employment, equity, and mental health. Through her involvement in many community projects, her social work career, her time with Dalhousie School of Social Work, and now her career in the Senate, Senator Barnard has maintained a deep dedication to social justice and racial justice. Senator Barnard advocates for reparations for historic and continued anti-Black racism impacting the lives of African Canadians in her work. And I am so pleased to welcome Senator Barnard in a great discussion today around tackling injustice, thinking about race and COVID-19. Really looking forward to your conversation today, Senator Barnard.
Thank you so much, Dr. Deepen, for that really nice introduction. And let me start by saying to CASW, thank you for organizing this session on this topic. I think it's really important that we talk about race, health, and COVID-19. It's essential, and it's the times that we're living in. So for this presentation today, I'll talk for about 20-25 minutes, and then we want to really get to engage with you in Q&A. And so I'll talk a bit about social determinants of health, about intersectionality. I'll briefly introduce the Racism, Violence, and Health study. I'll talk about the use of a race equity lens, and then using a race equity lens with COVID-19. Stress the need for disaggregated data. And then I want to end with a discussion around critical hope. And then we'll get to your questions. For me, that would be the most exciting part. When you look at this list of the social determinants of health. And we've taken this directly from the Health Canada website. Top of that list is income and social status. And keep these in mind. When we get to the discussion around race and COVID, I want you to be thinking about it, thinking about COVID, race and COVID in the context of these social determinants of health. So income and social status, employment and working conditions, education and literacy, childhood experiences, physical environments, the kind of housing you live in, social supports and coping skills, healthy behaviors, access to health services. And in Canada, we tend to not think so much about access to health services because, after all, we have free healthcare, but access isn't the same for everybody, as we know. Biology and genetic endowment, gender, culture, and then race and racism. And a point I want to make about that, the inclusion of race and racism as one of the social determinants of health is the inclusion of that, I think, is an exciting end to a journey that many of us have been on for so many years, advocating for the inclusion of race and racism as one of the social determinants of health. So you might think to yourself when you see this list, and you may wonder, why is race and racism at the end of the list? The reality is race and racism was only recently added to the list. But I'm so grateful that it's there now. And it's wonderful to see some positive things happen as a result of some lobbying efforts. So keep in mind when we are doing this work and we're engaging in discussion around race and COVID, and think about that in the context of intersectionality as well. So that's the theoretical framework that we're going to be working from. And in doing this work, in practicing social work, I think it's always important that we consider how our own experiences differ. And even in the same racial, cultural, ethnic groups, you're going to have different experiences depending on differences like immigration status, like income, like sexual orientation, like sexual identity, like gender, like ability, disability, like age. And so intersectionality, we always must bring that intersectionality lens to this work. So just briefly to mention the Race and Wellbeing book. This book comes from the Racism, Violence, and Health study, for which I was the team leader. It was a pan-Canadian study. It took place from 2002 to 2010 when the book was published. It took place in 3 Canadian cities, Halifax, Toronto, and Calgary. And in that work, it was qualitative and quantitative study, and the voices of about 3,000 African Canadians from across those three cities, and from different lengths of time in the country. So, of course, in Nova Scotia, majority of folks have been there for 300-400 years. Toronto and Calgary, newer immigrants, but many who were first and second generation as well, from the Caribbean and African nations. So we heard from a diversity of African Canadians in this study. But one of the things that really stands out in our findings, and that I want to highlight here today, is this issue of racism-related stress. And these 3 key points emerged as the types of racism that contributed a great deal to racism-related stress and the everydayness of racism. So the criminalization, and I'll talk a bit later about the over-criminalization of racialized people. Being underestimated or undervalued. That was such a significant finding as well. Being underestimated and undervalued, and how that triggers people. And then I'm sure this won't surprise you. The third key point was being subjected to the blatant acts of racism. And although the blatant acts of racism are not as visible in Canada, nonetheless, they do exist. And so the racism-related stress coming from those types of racism had a significant impact on the health and well-being of people of African descent who participated in our study. And when I think about the findings and I think about the book, Race and Well-Being, we've had to go into a second printing of that book. It's as relevant today, 10 years later, it's as relevant today as it was when we published it in 2010. One of the interesting things about that study in that book, when we did the book launch, people love book launches, media loves book launches. We did 2 book launches and couldn't get media to participate, which was just so annoying. But I'm digressing, and I want to carry on. So one of the other things that we talked about in the Racism, Violence, and Health study was the fact that racism-related stress really needs to be seen in the context of post-traumatic stress disorder. And racism-related stress is not recognized in the DSM, and it should be. And so if racism-related stress is not recognized there, then people who are dealing with racism-related stress and seeking mental health services through that medical system, they are not going to be properly diagnosed. They are going to be misdiagnosed. But African Canadians are quote-unquote victims and survivors of post-traumatic stress because of the racism that they experience. And we see it's not in the DSM, but we see it visibly in families, we see it in relationships, we see it in communities. And so we hear these stories and we know that the racism-related stress is very prevalent, but it's underground. People aren't allowed to talk about it. And people aren't being properly assessed if they're dealing with racism-related stress, but if healthcare professionals they're seeing don't identify it as such, cannot identify it as such. I want to share this one quote from this study. This was from one of the Halifax participants. And you can read that quote, but I want to highlight this woman speaking about the daily kind of microaggressions, the daily impact of racism, how racism impacts your health, all aspects of your health. And she says, it hurts worse than when someone actually hits you or you are physically assaulted. And one of the things we looked at in that study was we asked the question, is racism a form of violence? And overwhelmingly, participants said yes, it was, that it was a form of violence. And it hurts worse than when someone actually physically hits you. So that impact of racism that impacts health and well-being, we must pay attention to that. We must pay attention to the sites of oppression where racism occurs. When I teach about this, I will often ask, so where are the sites of oppression? Where are the sites of racism? Where does racism happen? Well, it happens everywhere. For some people, it's actually happening in their homes. It's happening in communities. It's happening in public spaces. Happening in schools. It's happening in banks and shops and in the healthcare system and the criminal justice system. It's literally happening everywhere. And the impact is profound. The impact is truly profound. And a lot of times, if it's out of sight, it's out of mind. So if people that are not aware don't know the impact and don't want to hear about the impact often, And so it's important for us to have these critical conversations. And for the social work community, it's important for social workers to facilitate these kinds of conversations. And then we need to recognize coping strategies. And some people find really positive coping strategies that help them be very resilient, such as spirituality and music and sports. There are a number of different positive coping strategies that people use. But think about folks that you work with. Many folks get caught in a cycle of disabling, negative coping strategies. So they may be, caught in more negative systems. Just this past week, I heard from a social worker in Nova Scotia who's working with a young guy of mixed race who moved from Nova Scotia to Alberta with his grandparents who are white. But this is a kid who lived with his maternal grandparents. And they were both white, had no contact with his father's family, who were people of African descent. So grew up feeling pretty isolated and dislocated from his culture. And as much as the social worker that I was talking with, as much as he worked with him and tried to help him, he knew that there was a gap there. He was looking for some same race matching. But this young man got caught in a cycle of negative coping. And unfortunately, he turned to drugs. And as a result, he died of a drug overdose just this week. And it's devastating. When you see that, you can almost predict what's going to happen, and you try to intervene, and it's too late. We're also seeing what I call post-traumatic racism trauma. And there are so many triggers. The microaggressions that I've mentioned, the blatant acts of racism that I've mentioned, but also the witnessing of racism. So when you witness, and witnessing can be just witnessing something in the media or on social media, but also the denial of racism. When people are challenged about racism and they deny it, that becomes like another form of trauma. So when I think about bringing a race equity lens to the work, I think it's important for us to keep in mind that we want to bring that race equity lens to discussions around policy development, and so on. I know the Indigenous community is doing a lot of work around the slogan, "Nothing about us without us." So really starting from the Indigenous perspective and working from there out. When I think about doing work specifically with African Canadians, we need to understand historical anti-Black racism in this country. And also we need to understand how the country has tried the great cover-up, the great teaching that this country has been the safe haven, the promised land. And it totally erases the history of that racism. And I think for white social workers who are on the front line or developing policy, it's important for you not to assume that you know intuitively what's going on. And so when we bring a race equity lens to the work, it's bringing it to all aspects of the work. So what do we do with COVID? When I think about a race equity lens, I think about the color of violence. I think about the color of poverty. I think about the color of crime. And then the last few months, I've been thinking about the color of COVID. So if we bring a race equity lens to an understanding and analysis of what's going on with COVID, even though nationally we're not collecting COVID-related data by race, but we're seeing a lot of these signs. And so if we think about employment, the overrepresentation of racialized people in frontline employment sectors, like personal support workers, the nursing profession, childcare workers. We think about the precarious work, like cleaners, those working shift work, the meat plants out in Alberta, temporary foreign workers. You know, I think suddenly Canada's recognized how significant temporary foreign workers are in this country in the agricultural sector. But they also work in childcare, providing in-home care. These folks have not been able to work from home. And they're more likely to be working in, you know, critical spaces, situations. Think about microaggressions, how communities of African descent are referenced in the media. I'm proudly sporting my Nova Scotia tartan scarf today. I did that deliberately. You know, I think that we can learn a lot from just unpacking some of the COVID stories that we're seeing in our own communities. We think about access to healthcare. We think about the people who have pre-existing health conditions. And that speaks directly to access to healthcare. And it also speaks to resources that are available to deal with preventive healthcare. So thinking further about the race equity lens, thinking about poverty, you know, those without secure housing, those living in housing situations that are very challenging. We have multi-generations in living in some households, for example. If you're told to social distance, if someone in your family ends up with the virus, how do you social distance in a home with one bathroom and perhaps multi-generations? The criminal justice system, the over-incarceration, the high prevalence of African Canadians, of Indigenous people in the prisons, and then what's happening in the prisons. Some of the stories we're hearing out of the prisons are very, very troubling, very, very troubling. We think about child welfare and the overrepresentation of Indigenous children in child welfare, of children of African. They set out specific practice directions around child welfare during the COVID, the height of the crisis there. I think about education, and we were talking briefly offline before we went live, and I was saying in Nova Scotia, schools are ending early on June the 5th. And I think about all of those children who don't have access to academic materials and resources that will help them prepare for the next grade level in September. So these are all concerns, and you know, we could spend a lot more time, but we have a 1 hour time together. So I'm going to move on. But if you think about the gap, the alarming gap that we see, and especially in the healthcare sector, the gender, race, immigration, and labor, it's profound. For those of you in the GTA, there's been a lot of conversation about this, and Toronto has started collecting race-based data around COVID, I think, which is really important. I'll pick on the GTA again, but just last weekend, there was this whole media blitzing around what was going on when the parks opened. In Trinity Bellwoods Park, thousands of visibly white people gathered, and it was clear that they were not respecting social distancing. But if that was a group of African Canadians who were gathered, the tone and the stories that were told in the media would have been very different. It would be telling a very, very different story. And you know, one of the stories that we saw on social media last weekend, the same weekend, were stories about the very visible police presence in Muslim neighborhoods because it was the end of Ramadan. So one of the things that we know, and the Alliance for Healthier Communities make this statement very clear. They say that COVID-19 does not flatten these disparities. And there are so many disparities. You know, I've been highlighting this disparities around race, but think about other types of disparities as well. So it doesn't flatten them, it amplifies them. I think if anything, we've become that much more aware of the many disparities that we have. And perhaps during the discussion, we can discuss some of those other disparities as well. One of the things is gender-based violence. And I know just last night, there's this story circulating today about an African-Canadian woman, 29-year-old. So we don't have all the full story. We don't have the full picture yet. But what we do know so far is that it was, the police were called to that apartment because of domestic dispute. I think one report says that the woman jumped from the balcony. Another report says that she was pushed from the balcony. There will be an investigation. The Special Investigations Unit will investigate that. But just keep in mind, as you're going, and as you hear the media coverage of this, the trauma of that, and when you bring a race equity lens to that, we know that there will be, even at the end of the day, there'll still be unanswered questions. But we have that, we see that link there, the anti-Black racism and misogyny, and the term misogynoir, coined by Moya Bailey. I like the term. But the reality is, you know, we don't have a lot of information because we're not collecting any of this data by race. We don't collect race-based data. And that's a good lead into the next slide. So many people across the country have been calling for disaggregated data by race. Even before COVID, health data, but also other data. There's a commitment, and I think we see some change in terms of Stats Canada and some of their collecting of data with regards to COVID specifically. We now have 3 provinces that are collecting the data, COVID data by race: Manitoba, Ontario, and Quebec. But we know the United States and the UK, they do collect the data by race. And we know that our experiences here will be very similar. And so we have that's one of the reasons why I'm using that term, the color of COVID. We know on all of those indices, the reality is that we're seeing overrepresentation in each of those areas. So when I think about critical hope, and I was asked about this the other day, when I think about just trying to move through and not just survive, but also to thrive. You know, one of the things we're trying to encourage people to think about is not just surviving the pandemic, but how do we survive and thrive through it? How do we help push through for resilience? I'd like to think that there are some great opportunities to do that. So I want to wrap up with a call to action. I think this is largely a social work audience. So to social workers who are working on the front lines, to social workers who are working in policy, to social workers who are working in administration, no matter where we are working in our respective fields, to social workers doing research, no matter where we are, I really want to encourage the use of a race equity lens in your work. So think about how you can bring a race equity lens to your work. And I believe that a part of being able to do that and do it well and to be a strong ally to push forward with some of the issues that we feel are so essential to us thriving through this pandemic would be, first of all, to listen and engage. So how do we listen and engage? How do we ensure that voices normally left outside of these conversations are invited in? And not just invited in, but actually listened to and heard. How do we respectfully hear what people are saying, even when it's challenging for us to do so? I often hear people say, well, I just need a safe space to be able to do that. So let me just say it here. Stop looking for a safe space. You won't find any. There's no such thing. If you wait for a safe space, you will never act. So we're not waiting for a safe space, but to listen and engage. And we need you to find the courage to be a change leader. Find the courage to create a braver space. Find allies and supports that you can work with to help you push through on those during those times when it's really, really tough to do so. And now I'll stop and we'll go to the Q&A. Thank you.
Thank you, Senator Barnard, for a really powerful discussion and start to such an amazing conversation in the Q&A. We've had some great questions come in. I think about applying an equity lens, and I know it'll help us tackle injustices resulting from racism globally during this essential response to pandemic. So this next question is important. As social workers, we know and understand a whole person approach. Since race and racism were only recently added to social determinants of health, how has the lack of its inclusion impacted social work? Hello. How can we ensure that race is included in practice and teaching going forward?
So that's my grandson, Gavin.
Hello, Gavin.
Gavin has come down for his snack. So Gavin is staying with his schedule as much as possible. And snack time is snack time. Whether Nanny's on a call or not, it doesn't matter. Right, Gavin?
This is our new world.
I believe that social workers have to be very intentional about the inclusion of a race equity lens. So although race and racism have just recently been included as social determinants of health, many of us in schools of social work across the country have been teaching about oppression and so on for years. I would say I started teaching at Dalhousie in 1990, and I think it was 1995 I taught the first anti-oppressive social work course. And so that's a long time. And I think right across the country, we had a project with the Canadian Associations of Schools of Social Work at the time, where we were doing this work right across the country and encouraging schools of social work across the country to be more inclusive in the teaching about oppression. So although race is new to the Health Canada list, it really shouldn't be new to social workers, because most schools of social work in the country have been teaching about oppression, including race oppression, for years. I will say, though, one of the things that I witnessed for a number of years is that even though oppression was included in curricula, there was more of a reluctance to teach about race and racism. People were more comfortable, teaching about oppression more broadly defined, as opposed to the specifics around race. And one of the things that I've done, and a number of other people have done in the last few years, is to really bring a specific focus to anti-Black racism, because we noticed there was such a reluctance to talk about anti-Black racism.
Right. Great points. Thank you. I encourage those of you that are listening, please continue to submit your questions. We'll do our best to get to all of them. I do have another great question for you, Senator. Race Gender, social class disparities for vulnerable populations, well, they've been well documented for decades. Can you comment on the impact of racism and sexism and the intersectionality of the two? I'm just wondering if I could also additionally add, what are your thoughts on the connection of this intersectionality to the vulnerable populations during COVID-19 pandemic?
So I talked about the color of COVID. We could also talk about the gender of COVID. So when you look at that intersection of gender and race with COVID, you think about the hotspots in the country, nursing and long-term care facilities, meatpacking plants, and then you look at who are the workers, the majority of the workers in those spaces. The majority of personal care workers, majority of healthcare workers are women. Majority of personal care workers are racialized women. Majority of those working in the meatpacking plants in Alberta were racialized women and men. And in some of those households, and also more likely to be newer Canadians, so newer to the country. Many of those folks are actually professionals, had professional designations in their home countries, but those degrees were not recognized when they came to Canada. And so they had to find work. And so they took work wherever they could. I can't tell you in Nova Scotia, for example, where I'm from, the number of people that I've met, racialized people that are working in long-term care facilities as personal support workers, but they have degrees in nursing and medicine, but they can't work in their fields because they're expected to retrain. And immigration, the lens, used, having those qualifications accepted in Canada, it really depends on what country you're coming from. I have an international PhD from the University of Sheffield in England. Best thing I could have ever done, because everyone in Canada loves a degree from England. But if my PhD was from the University of Benin in Nigeria, I don't think it would be seen in the same way at all. And those are the harsh realities that we need to address in this country, and that we don't seem to want to address.
When we think about addressing some of those harsh realities, I know as a woman of color, a leader and a social worker, also fellow PhD, we're often asked about our influence and in the ways in which we influence social policy and the intersection of the color of racism and ethnicity and pandemic influence. Can you talk a little bit more about how social workers can influence policy right now? What might be the best avenues within an organization or within a system?
It's sometimes, it's not always possible for social workers to do advocacy work in the agencies where they work. But we're very fortunate in this country because we have organizations like the Canadian Association of Social Workers, and within our provinces we have our provincial organizations. And guess what they do? They do advocacy. And so I think if any social worker out there is feeling like, I'd be putting myself at risk if I spoke out about these things. Well, what about sharing that information with your provincial association of social workers? What about joining a social action committee with your local organization, your local social work organization, or maybe other local organizations that are addressing issues that you feel passionate about? How can you bring that information to folks that they may not have access to because they don't know what's going on the ground? I often tell the story about being one of the 4 founding members of the Association of Black Social Workers. And there were 4 of us, 40 years ago, there were 4 of us who founded that organization. And I had the most secure social work position. I was working in provincial mental health at the time. And so I was often the spokesperson with government. And I would go to government. I never, ever told anyone that there were only 4 of us. But I would say, I represent the entire Association of Black Social Workers. This is not me as an individual speaking about the need for these changes, the need for these policy changes, but as the entire association. And we made policy change. We were able to effectively get the provincial Department of Community Services to change policies that not only affected people of African descent. Of course, that was the perspective that we were bringing to the work, but the changes that were made were positive changes for all of the families in the child welfare system. So sometimes I think we give up our power, we give up our voices because we don't think we have enough power. But there's such a power in a collective, even a small collective of 4. But we're very fortunate today. We have collectives that are much more powerful.
I love what you're saying about collective voice and spirit and energy around association level work. I am a huge advocate of how we partner both nationally and provincially. And there is power in numbers and collective voice. And that is much of how we do so much of our advocacy work as social workers, as professional associations have been established. I love this next question. It is a little bit about a GTA-centric question, but I think it's a great illustrative example around disparity. So I'll ask it and see what your thoughts are. A major transit provider in the GTA, of course, has reported a significant reduction in its ridership, more than 90%, of course, because of COVID-19. So as a result, the transit agency had to reduce the number of trains, buses, and accessible transportation. A U.S. study found that 60% of those who are still using public transit, of course, are African or Hispanic. And 56% of them have a household income of less than $30,000 a year. So the question is, those who require public transit are left in more dire situation, and disparity issues are even more prevalent. How does policy change impact those in unfavorable situations so quickly?
Well, the reality is that if a race equity lens was being used, we know why all of those things are happening, right? And if you think back to the social determinants of health, so we have people who are working in more precarious employment, people who are working for lower wages, more likely to be dependent on public transit. And then you have decisions, we live in a capitalist society, so decisions are made based on the bottom line. And so who's looking out for those folks? The reality is policy will impact different people differently. And when policy decisions are being made, if we're not bringing that intersectional lens, a race equity lens, a gender equity lens, if we're not bringing those multiple lenses to the policy development, then we won't even consider how a policy direction like that could have a significant change on people. It's totally unfair and totally unjust. But I think it's important. So who's speaking out about those things? Who's phoning the mayor and saying, look, did you know this happened because of this happening? Who's calling into the CBC radio? Because every day they're talking about COVID. So how are these issues coming forward? I mean, part of why we know so much about what's happened in the nursing homes is because people have been speaking out about it. And we can't just rely on family members who are so significantly impacted to raise awareness about these things. So where's the professional social work responsibility in that? Who's calling CASW to say, look, can you look at this for us?
Right. An opportunity to advocate collectively again, for sure. And looking at societal and environmental factors in those disproportionate issues. You mentioned prisons and corrections in terms of race and COVID-19. Can you speak a little bit more about that in the perspective on how social workers can advance change or think about this and apply the same equity lens you're thinking about?
I think the social workers working in prisons, their numbers are very, very low. And I don't know, I haven't heard any social workers speaking specifically about the conditions in the prisons. So again, there's a silence there. The conditions, so there's a lot of concern about safety for the staff, safety for the prisoners. But the approach to safety for the prisoners has been technically, in a lot of the prisons, I think, has been to lock them down. They're locked in the cells for social distancing because there's no other way to do it. Staffing numbers, are lower because of numbers of people being out, because of exposure, because of having the virus, or needing to be on lockdown because they came in contact with someone. So it's been really, really, really challenging. The Senate Committee on Social Affairs is looking at sort of impacts of COVID, and they had someone in just this week. I think that was yesterday, actually. They had someone in talking about someone from the union, and advocates have been advocating for safe release of some prisoners who, could be safely released into the community. It's been really, really difficult. It's a really difficult one because the general public, there's a real disregard in the general public for prisoners' rights. And there's a perception that you don't have any rights if you're a prisoner. And the reality is, the right that's taken from you is the right to be free in the community. But the rest of your rights, you have human rights, even as a prisoner. But that's not well understood. That's not well respected. And there's such a stigma. And most family members of a prisoner, quite frankly, don't want to do that advocacy because they don't want everyone to know that they have a family member, a loved one who's incarcerated. So it becomes really, really difficult. One of my senator colleagues, Senator Kim Pate, strong advocate, and she's been advocating for prisoners' rights long before she even came to the Senate, and certainly during COVID. And it's tough. It's really tough because we're not seeing the change that we want to see there.
Right. And the current situation is going to illuminate even more need, post-traumatic stress issues, mental health issues, a number of distressing family issues.
That's right. And the mental health issues are not adequately dealt with anyway. And so when you have someone that's on lockdown for hours and hours and hours, for days and weeks and months, I mean, the general public is reacting to the restrictions that we have because of COVID. So just think about what that's like, how that's magnified for those who are in prison.
Right. Do you know, Senator, if the Senate or any other government bodies are capturing race-based data on individuals who are being detained by provinces if they don't have sufficient self-quarantine plans upon returning to Canada? Are we collecting that data?
I don't know. I'm sorry. I'm not sure about that.
Okay. I wonder if this would also be something that would build on the need to collect age, race-based, ethnicity-based data across Canada and in several other areas, including COVID-19. And we're starting to move in that direction. And you commented that this is starting to happen more. Can you comment a bit more on the importance? I share your values around the importance in collecting this important data, especially now as we move into how we address now and later the impacts of pandemic.
The reality is we want to be able to plan well. We want to be able to do adequate prevention. And we need to be able to do good intervention. And the question I keep coming back to is, how do you do that when you don't have the data? How do you do that when you don't have the national data? And at the end of the day, you know, we're really looking at the significance of race and COVID. And we will be able to achieve better policies, better planning, better services and programs, and better outcomes ultimately.
Ice cream.
No, Gavin. Sorry about that, everyone. But it's my reality. We'll be able to do better with that if we have the data.
Right.
And so, you know, we know, so we continue to lobby and push for that to happen.
Right. I agree. So I want to take a couple of moments and see if there's any additional questions. I can't echo the number of accolades coming in behind the scenes on having this conversation and the importance and relevance of this collaborative approach to thinking about race and equity lens and applying that. So I'll take a few moments and just check to see if there's additional questions. Did you have any further comments before I ask you the last one or two questions and wrap up?
I'm sorry, are you asking me?
Yeah, any further comments? Yeah, I'll ask you the last couple of questions. Yep.
Yes, that's fine.
Thinking about shining a light on bare inequities and healthcare right now in COVID-19, what inspirational advice would you offer to the new social workers who are graduating into this current space right now?
For the new graduates just coming out, first of all, you've been robbed of your actual graduation. But I hope you're celebrating. I hope you pause and celebrate your graduation. And I did a message for the Dalhousie graduates. I was asked if I would do that, and I gladly did. So I'm going to share with you what I shared with them. And what I said was this. So yes, you know, there won't be an opportunity. That's not here. What I said to them was, you know, you won't have an official graduation, but 2020 will be a year you will never forget. You're graduating in the midst of COVID. And I said, if there was ever a time that we need social justice warriors on the ground, it is now. And so I'd like to think about our social work graduates going into the field, feeling well-positioned and well-prepared to fight for social justice from whatever location we're in. And if we all do our part, if we all engage, if we all try to carve out a piece of this work, there's a lot of work to be done. And if we all try to carve out a piece of that work and engage in that work, so whether it's with your local, whether it's in your employment, I mean, some people can do it in their employment, or whether it's with your provincial organization or with the national organization of social workers, let your voice be heard. And also, one of the things, and I think something that's pretty easy for people to do, I think. People are plugged into social media now more than ever. And when people see something in social media that they find offensive, there's a tendency to just not say anything. And people who don't agree with whatever is being presented, they remain silent. And that silence is perceived as agreement. So one of the things I always say to people, a way to really test your bravery in terms of social justice is taking a stand, speaking back, sharing your views, saying if you don't agree, just, you asked if there was something I wanted to speak about, and I don't even know how I forgot about this. But I wanted to mention, there are so many things. But thinking about post-traumatic racism trauma. And so we had this situation with this young woman in the Toronto area who died last night. But just a few days ago, we have the African-American man, George Floyd, and I want to call his name, George Floyd, who was killed by police in Minneapolis. He was killed by a police officer having his knee on his neck. And people filmed it. People tried to intervene. People tried to get the police to stop. And 3 other police officers were witnesses. And I watched, I don't watch a lot of CNN, honestly. That's the truth, I don't. But last night I watched Don Lemon, an African-American journalist. And he talked about being exhausted as a Black man in America, being exhausted by the racism. And he interviewed a young man who witnessed and filmed what happened with the killing of George Floyd. I don't remember his first name, but his last name was Williams. So this Mr. Williams was on. But one of the saddest things that I heard in that interview was Mr. Williams, and he cried on CNN. He cried because of the trauma of witnessing a man that looks like him. He doesn't know this man at all, but he's in tears. And part of why he's in tears is because he had an instant flashback to being 16 years old. At the age of 16, he and some of his friends were at a school event, and they were out late, and they were afraid of the police, and so they were running home. And one of the friends was shot in his own neighborhood before he got home. And so when he saw Mr. Floyd being murdered, he wasn't just in that moment. He was having post-traumatic stress, post-traumatic racism trauma, because he was reliving an experience he also witnessed when he was 16. So the impact that has on people is unbelievable. And also when you think about being a bystander. Now, that's a gruesome example, but it's a real example, and it happened in North America. But it reminds me of how people are often bystanders, right? Silent bystanders. And we can't afford, in the social justice movement, we can't afford to have people as bystanders. We really need people to take some action. And that action can be as simple as recording something on your phone, as this man did. He did more than that. He tried to get the police to stop, but he didn't do more than that because he knew that if he intervened too aggressively, he could also end up dead. So he recorded, he remained calm in the moment, but I think that man will be traumatized forever. And I don't know if he'll really ever get the supports that he needs to be able to move on from there.
As I think about what you're saying and reflecting over the last several weeks, there's been this common thread around mental health, especially worry. And yet the disease itself and the large societal consequences that are affecting Canadians are not affecting us equally, especially around mental health and trauma and PTS. And you mentioned racism-related PTSD, and we really need to be thinking about that, and attention will have to be paid to that both now and after, especially around worry and trauma, as we think about different social groups and how they're affected and how society recovers. And so I want to thank you for this amazing conversation. You've reminded me that reliable, collaborative evidence must underpin all our clinical thinking, public health, social policy, and our social interventions. And with that, I want to thank you and pass it back to Alexandra from CASW to close us off for today.
Well, thank you both so incredibly much. I am so deeply, deeply humbled by this experience. I know that there are many people that attended this event that even said, I didn't think Senator Barnard would actually be here. And what an incredible insight into this new world that I think that we're all going to be finding ourselves trying to act within. So I hope that we take what we're learning here in these webinars and start applying it into our practices every way we can. So just a massive heartfelt thank you. Thank you for your comments about engaging with the CASW. I love to hear from our members. You influence a lot of our policy directions and a lot of the ways we go and a lot of our advocacy priorities. So please know that we are always here to hear your questions, your comments, your concerns, and that we appreciate the partnerships such as the partnership we have today with our one of the provincial associations in Ontario, as well as with the Senate. So please know that we are always here and that we love to get your comments and feedback, and take a couple of minutes just, I think, to take some deep breaths after this webinar and go out into the world ready to start not being a bystander and to be a change maker, to listen and engage, and to use a race equity lens. So thank you, Senator. Thank you, DP. We're going to end today. Any final comments?
I did want to make one more comment, if I may.
Absolutely.
During COVID, we often hear the slogan, we don't want to leave anyone behind. And the reality is, without the collection of race-based, reliable, robust, race-based data, we will be leaving whole segments of our population behind. So to better prepare for the next wave that we know is coming, we need to get it right now.
Absolutely.
Thank you.
Thank you. So thank you. With that, I am going to end the webcast. Engage with us as you always do on Twitter, on Facebook, by email. We love hearing from you. Thank you for spending another hour with us, and we will see you very soon. Have a great day. Bye-bye.
Thank you. Bye.
Thank you.